that we have seminars not only online, which obviously was forced with COVID, but in addition here, jointly held with the University Pontifical Catholic University of Rio Grande do Sul. And for me, it's a really exciting, because over the decades that REAL has been around, a very large number of Brazilian scholars have stopped by REAL at some point here in Illinois to spend a bit of time for their research. So it's really exciting. I'm very, very thankful to Professor Augusto Alvim for facilitating this process, and extremely thankful too to Eduardo. I think Eduardo is online too, to facilitate the process and make sure that we have an announcement and select the speakers and all of that. So thank you very much to both of you. And then with that, today we are going to start with Luis Carazza first, and then William Adamczyk. So Luis, whenever you feel ready, it's all yours.
Okay,
we cannot say, okay, good, yeah, perfect.
Okay, now, so today I'm going to presentation Uber and Traffic Safety Evidence for Brazilian Cities. This paper is made a partnership between Yuri Barreto, Raul Silveira Neto, Luis Carazza. Yuri Barreto is a student PhD from Federal University of Pernambuco. Raul Silveira Neto is my former advisor from Federal University of Pernambuco, and I'm professor at Federal University of Pernambuco. So what's our motivation here? I think it's important. About more than 1.35 million people die in traffic accidents worldwide. It's the main cause of death of children and young adults around the world. So estimated cost up $5 billion in Brazil 2014. This is data for today for IPEA. And the estimated cost is about 209 million reais. It's $86 million 2016, just considering Brazilian public health system. So its motivation is new technology versus human mobility. So the point is, does ride-hailing apps affect traffic safety in developing countries? We have some data, some papers in developed worlds, developed countries. So Brazilian Kirk had found no effect about Uber in new cities, as Deus and Mulholland found reduction in traffic fatalities and crime. High number of barrios found actually there is more traffic fatalities when a city adopts Uber. And ride-hailing in ambulance volumes, it is a paper from Moscatel-Slutsky, found a reduction in ambulance volume. But there is no available evidence for developing countries. So what happens when a Uber enters in a new city in developed countries? So that's the most motivation for our work. So if you get a look of our peers here in South America, even in America, you see United States and Canada, even Germany, you see the fatality rates by country. Brazil is the one of leader, about 20 deaths fatality rates by country in Brazil, one of the most impacted country. So that's one of the most cause of death in Brazil as homicide. So we have very high traffic fatality rates and drug drive fatalities prevalence. So people like to drink and drive in Brazil. Okay, despite some dry law that way, we don't have a kind of reduction in papers show this in Brazil. But we have a different market from Brazil to America. Like in Brazil, only 36.5% of Brazilian households own car, against 80% USA. We have a really poor public transport infrastructure. We have high level of poverty and inequality, and Uber service were never low than 2.5 times bus fare. So bus fare is quite expensive here in Brazil. So we have in this decade a new scenario. There is a growing motorization. There are lots of new cars, especially in the beginning of the decade, and I use even more of a smartphone. Okay. So there's a research for Coelho he shows that about 70% of Brazilian Ubers had income of 5 times the minimum wage, and more than about 80% of Uber users had a car or motorcycle or both. So Uber is used most for people that is a high income and also have a car or motorcycle. So individuals between 16 and 37-year-olds is about 76% of Uber users, around 40% are less than 27 years old. Almost 7th of Uber users is motivated by leisure or has a home destination. So 45% being the percentage of leisure. The Brazil is the second largest market of Uber in the world, just after USA. So this is a simple conceptual framework. This if we take it from the Barriers paper, he has done it for USA, and he found actually a positive effect when the Uber entered the city in fatalities. But it's important to show here, we don't have any data to prove if this is correct or not. It's just a conceptual framework. Okay. So what impact? That's the question. Okay. When we have some changes in these variables, this is impact positive or negative to air traffic related accidents. So there's 3 important features here. We have vehicle miles traveled by city I. We have vehicle symptom districts in the city I. You have driver's quality in city I time t. So in America, perhaps, Barrios found that the number of vehicles miles traveled, it impacts positive. More vehicles travel more miles, more the chance of accident. So Barrios found it's positive in America, in USA. So as vehicles simultaneously in the streets in city I, also more vehicles traveling simultaneously, more is the positive impact of accidents in the cities. Okay, but here in Brazil we have a lot more less cars than America, and we also have a point that's important. That's the driving quality. That's the main chain that we have found. That's just, as I said, I have data to prove it. But you imagine that some people that don't like to drive, some people that drunk and have to drive, they perhaps change their own car for the Uber. So that's the most impact. It how we find the negative effect of Uber in fatalities in Brazil. Okay. So let's talk about Uber in Brazil. It's launched in 2014 in here in São Paulo. Okay. Almost 115 Brazilian cities in 2010, 22 million users, 6,000 drivers, 600,000 drivers, and 1 billion trips. And São Paulo case is important because the first city in Brazil to adopt, and it's the most important city in Brazil, okay? The biggest city also. So this map is quite difficult to see, but if you see Rio in São Paulo was the first city to enter Uber. Then 2015, another 3 cities entered, okay? And 2016, 36, 2017, 44, and 2018, 36, okay? It's sure that Uber enter in the city, there is more return of scale. I mean, in the big cities, the metropolitan area, okay? They not like to enter in the small cities because don't have a return of scale positive, okay? So it is just a verification of what I've said, that never Uber, okay, the population under 1,100 inhabitants. It's only 6 cities. If you take 100,000 inhabitants, we have 109 cities. So we have a slice of data and work only with cities that has more than 100,000 inhabitants. Okay. In the robustness check, we have try again with all population. Okay, you don't have this slice, and we show that the impact is still negative and statistically significant. Okay, so how to get the data? The data of Uber entry We get from Uber sites, okay, website, and from the press. Okay, it's not a kind of detective work. We have to find when Uber enters. Sometimes it's, sometimes not, but we have done it. And we found the mortality and hospitalization data from ICD-10 data source, SIM and SIG. It's a data from the health ministry. Okay, we have also yearly labor income from HICE. Is a data from labor income, as I have said, and the year population projection we get from IBGE. Okay, we also balanced the panel data from 2011 to 2016, third quarter year. Okay? So this descriptive statistics with city more than 100 inhabitants, that's the panel we have found. So traffic fatality rate, the mean is 4.1. Next slide I'll show how we found it. And traffic hospitalization 25, population, the mean is 306,000. More or less, labor common in reais, okay, in 2016 is about 200,000 reais. Okay, so we have found first we see if you pre-treatment treatments if they have the same path. You see it's quite similar. Special hospitalization is quite similar. Went down, down, down. This is the same, and up is the same here. Fatality this fall here is the same here, then up here is the same here. So that is important for analysis and study different approach. Okay. So what is our empirical strategy? Use the time of treatment, difference, similar of Abraham's son, 2019, use event studies, then the robustness checks, then falsification tests. So this is our usual D&D approach. Okay, we have a constant, a city that has Uber or not, some controls, some fixed effects, and the error. Okay, if it's the same, but it's divided from different years or quarter in this way. Okay, so how we found the dependent variables is ICD-10. We use a rate, there is occurrence based on 100,000 over the population of the city, the time, the city I and the time T. Okay, and we also made a log of it. So we put 1 plus this mortality rate. Okay, also did it with the traffic hospitalization. Why we did that? Because it's important to some, especially in small cities. That's one reason that we have this slice of the data. But in small cities, in cities that has another hospital, if it's too better than another, it's closer to each other. Okay, sometimes it's important to smooth, and we kind of balance for different population. So if you take São Paulo, for example, it's the biggest city in Brazil, so have measured it by 100,000 over the population. You can compare it with a small city. Okay, it's not perfect, but it's one way to do it. So let's show our results. What we see, this is traffic fatality rate in log, as I said here. Okay, and we try different kinds of specifications. Now, first we used seed effect and the year fixed effect. The result is still negative, statistically significant. Okay. Now we add the quarter fixed effect. This is still significant, negative effect. And we put the controls. That's a log of population, log of income. And it's still negative, statistically significant. Now we use a linear trend, time trend. Is still positive with the controls. Is still negative, statistically significant. And use seed effect, fixed effect, and use a quarter by year fixed effect. This quarter by year is just multiplication of quarter by year. Okay, it's made different terms and iterate each other. Okay? And that's a fine estimation that shows that Uber has impact in the cities that Uber entered about a drop of 10,000 about 10% of reduction in fatalities. Okay, we did the same approach with hospitalization rates. Okay, it's the same I have done before in traffic fatalities, and I have found that there is a drop, a fall of about 16% of the number of hospitalization when the city, Uber entered in the city. Okay. So this is the event study. What we expect? That previously there is no impact. Okay, it's true. Fatalities pass through it, and we hope that after the impact is negative. So in the first quarter we have no impact, and after the fourth quarter, this impact is negative and still growing. Okay. Hospitalization is the same. There is no impact before, and they have impact after the third quarter, and it grows after time pass through. Okay, and we have a different kinds of when you study city, because sometimes you have residents only and place it accident happens. So you use the place with accident happens. So now you use only residents. Okay, I mean only the place that the person who had the accident or the hospitalization, only if he resides in that city. Okay, so we also found in the event study there is no impact prior, but later we have impact. Okay, that's important. So what happened? Why we found these effects? Okay, after some maybe third or fourth quarter. That's because when Uber entered the city, we try to find the Google Trends for Uber in the first 5 Brazilian cities. It's different from America. We don't have this data available for all. We just have for some cities, okay? So it's different here, and that's the data that we get. So we see when the Uber enters, there is exponential growth in the Uber search internet, and it's especially it grows a lot when after the third or the fourth, okay, quarter. So that's the impact that when first there is an impact of Uber, it takes some time. It's not specifically when it enters. And especially in the beginning of Uber in Brazil, we have especially issues with some taxi drivers. Okay, we have some kind of violence taxi drivers with Uber, and we have some afraid of some of the impact how used. So when people most use and see there is no problem, it's good. Okay, so the number of people is still growing, and that's why we found that impact is not immediately, it takes some time. Okay, so let's test the robustness checks. We see here when we made a cut, we use the main sample in the cities. This is still negative and insignificant. That's okay. When you use only Uber cities, we see the event study is also good. There's no problem. Okay. And now we check different kind of specification of the data, the sample. Now all Brazilian cities with 50,000 more inhabitants, 150 and 200,000. We see only that hospitalization has a fail here and don't pass this test. Okay, and also fatality is good, all of it. So we leave one cohort, leave one city out. We take one city like São Paulo and run again. Then we put São Paulo again, take out Rio and run again. We see fatalities pass through it, but hospitalization has not. And we did the same experience with one cohort. We take one cohort and run again the code. We see fatalities is okay, but hospitalization has some fails and not pass the stress. Okay. Now we test about some falsification tests. We use some data that's not related with Uber and with traffic accident, like poisoning, suicide, overdose, and non-traffic related deaths. And it's also non-significant and shows us there's no spurious relation regression here. Okay. We have done also the event study for these variables. It's also passed. So we found there's actually no spurious relation here. And finally, the final considerations. We have the traffic fatalities in the treated cities without Uber is 10%, or 1.5 deaths by quarter in the average size city. There is a larger effect of in traffic-related hospitalization, about 70%, but with some our estimation shows that it's not robust, so we cannot infer anything here. So our result is robust, different specifications, sample restrictions, and falsification tests, and different from the available evidence from US cities. Okay, so we have found a different data, different results that Brazil, the author, has found in America, for example. Okay, and the first, as you best know, there is an impact of Uber in development culture. Okay, and learn adapt and effect. I mean, there is some time to people use Uber and it will impact. Make it clear. Okay. So that's it. I think I get my time, 20 minutes. Sorry, sometimes I'm quite fast, but I try to be in these 20 minutes of our presentation.
Okay, Luis, thank you. Yeah, really, really interesting work, really excellent and very well presented and completed. So I have a couple of comments for you. So the first one is actually based on the defensive technique itself. So here the idea is that the only factor that really changes is the presence of Uber, right? But in reality, I'm quite curious if you control at the same time whether some other factors have played into reducing the number of fatalities. In other words, do we see that there is eventually more police presence? Even if Uber has been introduced, it could happen at the same time as a little bit more police presence, or eventually that the speed of traffic in a city has been reduced. So in other words, have you considered controlling for other factors that could also lead to less fatalities and hospitalizations?
Okay, it's difficult to find some measure of that because there's different specifications for each city. Okay, São Paulo in the last 2 years has reduced the speed limit in some areas. Okay, but what we have done, we check our specification when we put some city out and put it back. So we try to use this, we've taken the cities and put it back. If one city out, we have done. So it's the fact they only captured by São Paulo, we have taken out from the data and try again, and this is still robust. So, okay, it's it's a very...
Yeah, I see your point. It's just you need to eventually make it very, very clear because it's going to be eventually a factor that is going to complement the introduction of Uber in those cities. The second comment I have for you is this. So you chose to focus on very large accidents, the ones that are basically leading to fatalities, hospitalization, so on. I'm a little bit curious as to whether we see a decrease in the trend of just less big accidents. In other words, just an accident, no one got hurt, but still an accident occurred. Is it something that you think is of interest here too?
Sorry, Sandy, I don't get it. Can you please
Okay, I see it again. You agree with me that in your models, you are looking at the dependent variable, the number of fatalities, the number of hospitalizations. So you know they obviously occur after a very serious accident. You know, people were really driving way too fast and it led to that. But as you know, there is a very large amount of accidents where, you know, your car gets scratched, no one gets hurt, there is still eventually a report for your car insurance, but that's it, everybody is still alive. Do you think that it's one aspect of the story here that you are interested in also?
Okay, for sure, it's important, but in Brazil, I don't know if you get it, but we have a major problem about data, okay? So why you use sometimes Brazilian to work with violence, crime, or Uber, something like that, the urban problems, normally use death. That's because we have a data source database that is important to us, and it's also, we know kind of sure that the data is correct, okay? But when we don't have the data, for example, for car accidents, okay, the insurance companies don't show it for us. We don't have this information, Okay.
Yeah, okay.
And
In this case, I agree with you. It's very difficult to do anything
we
about
don't
it.
have it. So it's important to see, okay, sometimes you have a major accident, but nobody's hurt. Okay, but we don't have it data in Brazil.
Okay,
So it's
I
really
get it.
difficult for us.
Okay, perfect. So in this case, to prevent anybody to ask the same question, just make it clear. I will say in the first part of your presentation, indicate we've been thinking about it, but unfortunately the data don't exist. So we only focus on the very, very serious accident. Wonderful. Let's get more comments and questions for Luis.
Luis, congratulations for your presentation. Thank you very much. I have a very curious too about a subject similar to Sandy. As you know, in the Brazilian cities, you have a huge difference in terms of public services, public transportation. Some cities we have subways or metros, in other cities not. So the number of lines of buses in different cities is not the same as a proxy of quality of this service, for example. So I was thinking if it's not possible to include these two ideas, it's first of one to put buses or metro. You have, for example, Porto Alegre, you don't have subways. But in São Paulo, in Rio de Janeiro, you have a subway, so it's a different aspect for user or not Uber in these cities. So I was thinking about this idea, just to
it's good.
see what do you think.
Okay, good point, Augusto. Thank you. And actually, it's my opinion. Okay, I have no other cities in Brazil, but I think only São Paulo has a metro subway that works. You know, here in Recife it doesn't work good. In my former city, Brasilia, doesn't work really good. Just take one part of the city, and Belo Horizonte also. Here sometimes works or not, but subway I think it's in Brazil is not work properly. So okay, but I think it's a good point. We have a meeting this afternoon with Yuri and Raul. We're gonna talk about it, and I will show them this point. It's important. If you found
let me ask, Luis, did you have city fixed effect in your study? Did you
yes.
Some city? So,
yes.
So actually, if a subway existed before Uber and still exists after Uber, it's captured in your city fixed effect. But the point of Augusto makes sense if the subway is introduced after Uber, because it goes back to my previous point. It is one more mechanism by which fatalities will decrease. But otherwise, if it was there before and after, it's captured in a city fixed effect.
Okay.
Similarly to...
I don't, sorry, I don't know, but I think São Paulo has expanded. Also, Rio has expanded, but it's not new. So I don't know if you fixed effect captured or not.
So if you were to expand and the number of riders of the subway increases, I would very much suggest that you put it as a covariate, because you basically, again, it goes back to my point, anything that in addition to Uber may have helped to decrease fatalities after Uber has been introduced is one more factor that explains that downward trend that you find. So just control for it if you can. If the data are not there, simply indicate, well, we know it could matter, but unfortunately, we don't have the data for that. Okay. Okay. More comments, more questions for Luis? Okay, so in this case, I think we're going to move on. So thank you so much, Luis. It's very, very nice work. Now I'm going to feel comfortable taking Uber next time I go back to Brazil. And we are moving now to the next presentation. William is in charge. As you know, William is from the Pontifical Catholic University of Rio Grande do Sul. And William, whenever you are ready, feel free to share your slides. So let's see. So we can see you. I can see your slides. And can you say something, William? I want to make sure you're... William, I don't know.
Yes.
Okay, perfect. So everything is good. Everything is good. Yeah, it's up to you. Thank you so much.
Thank you for the invitation to present this paper to you. Thank you for professors for attending it. And excuse me for any mistakes I may, something wrong that I may say here. It's been some time since I made an English presentation. Our work here, it's about inequality of opportunity in Brazil. And I bring some recent trends and some pitfalls that we are encountering along the way. This study is based on a previous paper that emerged from my dissertation thesis at PUC under supervision of Professor Adelar Fochesato, that's here present as well, when we investigated the inequality of opportunity in Brazil between 2001 and 2014. And the idea here is to update some of these estimates to until 2020. Just to give you an overall perspective of what was happening in Brazilian economy until the pandemics, until the year of 2020, that I think this perspective will be relevant to some of the discussions that we can make here. And in Brazil, in recent years, in the last 20 years, we had two different moments. Until 2014, here we can see that GDP growth was accelerated. We measured something about 2, 5, 6, even 7% in some years of growth, alongside policies as social programs, conditional cash transfers, like Bolsa Família, that help to decrease income inequality and foster growth. Meanwhile, we had low unemployment rates. We had here almost 3%, 4% rates of unemployment in this first period. After 2015, we entered a severe economic crisis. We had two years of decrease in the GDP, about 3%, 3.5% in 2015, 2016. And from 17, we had a low growth, now around 1% in the last years. So we had these two distinct moments that we should consider when we are seeing these results of inequality of opportunity. The last period here, we can see, besides economic crisis, we have some efforts for fiscal austerity and a rise in unemployment. It was about 11% before the COVID crisis settled in, and right now it's about 40%, 14% of unemployment. But one important aspect to see here, it's income inequality. We will start this investigation looking at income inequality in this period, and Brazil has been widely recognized for having success in diminishing, in decreasing this income inequality in the 20s until 2015, 2016. So I divided this blue line, this upper blue line, it's the income inequality measured by with PNAD data. For those who don't know, PNAD, it's a sample. Every 10 years, Brazil conducts a census of its whole population, around 211 million inhabitants. But every year, the PNAD was conducted investigating only a sample of this population. We're talking about 300,000 persons in the sample. By using Gini index, we can see that this income inequality has been decreasing until 2014. After this, this dotted line here, PNAD, as it was constructed annually, changed from PNAD to PNAD continuous. It's a continuous because it's made along all the year, and had some different some difference in its methodology that we should be aware of. So the results are not directly comparable, so I make this separation here, but they are very close and they even overlap in some of the years. But we should take some careful by reading this. After 2016, we see an increase in income inequality measured by the Gini index. In inequality of opportunity studies, a better index to be used is the mean log deviation. So I bring to you this yellow line where we are using the mean log deviation. That a difference to the Gini index is that MLD is more sensitive to the tails of this distribution, especially the lower tail of the income distribution. Since we are concerned here in investigating the effects over the poor and not the top of this distribution, this is another limitation of PNAD. It cannot capture the top incomes of Brazilian distribution. We are more concerned with these lower incomes. So MLD is more sensitive than Gini to these changes, and it can be decomposed by studying inequality of opportunity. And we see the same trend. It falls until 2016, and then it goes back up. But inequality of income is not the best choice to measure inequality in a society. So we have some normative choices that we have to make to assess these trends. The first one that we talked about was which inequality index should we use? So we opt for the mean log deviation index. And the second choice that we have to make, it's Y income. Here I brought to you a brief history of the developments in the theories of income inequality, starting in the 70s with Atkinson relevant work on the measure of inequality of income, inequality of consumption, on the inequality of wealth. Basically a financial dimension of inequality. And later debates, we can see John Rawls, he brings a theory of justice where he will ask for an equalization of primary goods or social basic goods that everyone should have. Amartya Sen will develop his theory based on capabilities, his notion of justice based on capabilities. And from the 80s, there is this responsibility sensitive egalitarianism. They will say basically that that's not all inequality, there's not all forms of inequality that are bad. There must be some inequality that are sensitive to efforts. And those inequalities, those differences in income that we can attribute to personal or individual effort, they can be justified, they can be morally acceptable in a society. So Romer in the 1980, with this his influential book, Equality of Opportunity, will formalize and provide some actual ways to measure inequality of opportunity. I brought here an important phrase from John Homer, and he says that he's militant about annihilating inequality that comes from circumstances. This is a simple way to state the inequality of opportunity theory. So circumstances should be compensated or eliminated in some cases, but he is uncertain about how much inequality a society could endure or could allow due to differentials and effort. okay? These individual effort measures. I would add to this notion not only effort, but luck. Maybe we should accept or introduce some restrictions in difference in luck or economies of scale. Economies of scale, I'm thinking about Mark Zuckerberg. He has all the merit that developing a large company in his, and the work he put into it. But due to economies of scale in the technology growth, he earned billions and billions of dollars. So what is the point that we should compensate or restrict this inequality is something that this theory leaves open to discussion. Then we go on to investigate what are the circumstances that we consider that are morally unacceptable or that we consider are unjust. To start with, sex and color. We will bring this notion that sex and color are not acceptable based on three different theories that the economic theory brings, like taste for discrimination, statistical discrimination, and occupational segregation. And why we use also the formal status in the labor market, okay? We see the difference in income that comes from informality. That is a serious problem in the Brazilian labor market, that about 40% of the workers doesn't have a signed contract, doesn't have the access to social security and other benefits that a formal labor contract could bring. So we see that this informality, it acts like a trap, showing some path dependence. The advantage worker that exerts informal labor, he's trapped in some way and has difficulties in accessing the formal labor market. We see as also the formal sector queuing. Bosch and Malone will bring to us that informal salary work is most of it involuntary. Individuals would like to go to the formal sector because higher salaries, because these benefits and security, but they can't. And formal labor are a symptom or a representation of regional disparities, especially during economic crisis. Imagine with me a region that is so poor or that is dominated by informal labor market. There are no formal contracts that this worker could apply to. And the fourth, the most important circumstance that we will consider unjust is the family background. Here we see the Great Gatsby curve brought by Korach and widely discussed in the inequality literature. And we can see there is a relationship between income inequality, Brazil being one of the most unequal in the world, especially in the 90s, with intergeneral reproduction of this inequality. The inequality that passes from the parents to the child. So there is this positive trend that shows that family background has an important and unjust impact on the results of the individuals. To measure it, we use a special supplement that was conducted in PNAD 96. There will be a problem for us, this lack of data for more recent periods since 96. That includes father and mother education and income, and we use it to measure family background. So Talking briefly about the methodology, we are using the parametric method for estimating income inequality of opportunity, created by Ferreira and Guignux in 2011, where they construct this idea that we should regress these circumstances and create a counterfactual or an alternative distribution of income that is explained only by these unjust circumstances. So we can apply inequality index to this unjust distribution to see the absolute inequality of opportunity. What if the distribution of income was generated only by these unjust circumstances? Then we will have this measure of absolute inequality of opportunity. And we can see the relative inequality of opportunity. So we can see that dividing this estimated absolute by the real income inequality measure as well by with MLOD in the actual distribution, we can have the relative. How much of the total income inequality can be decomposed in, or can be explained by the inequality of opportunity. And then we make some assessment here using Lindemann, Miranda, and Gold measure to check the relative importance of these circumstances in the inequality of opportunity. Details about this methodology are well explained in the paper that we published in March. So we can see by using the PNAD data until 2014 that Brazil had this success in reducing total income inequality. The higher bars here will consider the total income inequality that we consider this darker area as the inequality of opportunity. This will show us the absolute value of the unfair component. So we can see that the total inequality of income, there's only a fraction here, about 30%, that is that we consider unfair. But the good news that we saw a decrease here. We saw a decrease in total income inequality, and we saw a decrease in inequality of income of opportunity as well, and they decreased in the same proportion. Both went down. So when both then decrease, we have a fairly constant relative measure of inequality of opportunity around 30% here. I skipped a slide. Then we are doing now an update in these measures by considering the new PNAD, the continuous methodology of PNAD. So we can see that from this new data, from 2012 to the most recent data set, we can see that occurred a reversion in this total inequality trend. It started to end up from 16, but the bad news is that the unfair component is increasing continually in this sample. If you try to assess this, if you try to see it as relative inequality of opportunity, we can see the stability in the first period, but in the last period, we can see that is growing inequality of opportunity. And this matches just that year, 2015, 2014, when the GDP started to decrease and the economic crisis happened, unemployment went up. And we can decompose it by circumstances. The most relevant to us here is to see the trends in the formal sector. There is this significant difference between formal and informal labor markets, the family background, we are supposing as constant due to this lack of data since 96, we are supposing just adding it linearly to the data. Then we see difference by color and difference by sex or gender. We can see the most recent trends here. Formal sector starts to increase relative to the other circumstances. Personally, we haven't tested it yet, but seeing another overall inequality studies, there is a significant impact of rising unemployment over this growth in the informal labor market and growth in inequality as well. The most striking figure that I wish to show you is these opportunity profiles in Brazil. Then we decompose these circumstances, as Romer calls it, the types of individuals, like type 1, type 2, type 3, where we can see this combination of circumstances. If we see the male, white, with a formal labor contract in 2001, he had this 1,600 reais already converted to 2014 prices. So we can see that he gained some income in this period. He is better off than in 2001. But if you look at the lowest part of this distribution, you can see that female, non-white, informal, it has about a third of the income of the male white formal. But she passed through relative gains in this distribution. So the bottom of the distribution is showing us some improvement better than the already most advantage from 2001 and 2014. If we look at most recent data, we can see that this trend, the relative positions, they are sustained with minor inversions, I think here, 3 and 4, but this pattern reproduces over time. But this trend in the bottom of the distribution, rising faster or getting better than the top of the distribution, this trend vanishes. With the rising income inequality and with the economic crisis, we don't see anymore that improvements in the previous period. We can see, as I promised you, I brought this map, Brazilian map, where we assessed the regional inequality of opportunity, where we can see that the northern states of Brazil are the most disadvantaged. Here they have the highest inequality, they have the highest inequality of opportunity, the most precarious conditions in the labor market. Santa Catarina and Rio Grande do Sul, where is PUC, it's amongst the better states in inequality of opportunity. Our study has some clear limitations that we're trying to overcome somehow, but as the previous studies in inequality of opportunity, we are estimating a lower bound. Lower bound, we are considering the most conservative or the least polemic circumstances to get the minimum. Where is the bottom of this inequality of opportunity where we can act on, and it's easier to get some agreement from society in general. There is another problem that PNAD underestimates this income inequality. It will not capture the top incomes in the society. For it to get these higher incomes, we should use federal tax data that are not disclosed by the federal government, but authors that had access to this data, they verify a higher inequality in general than the PNAD brings it. And the most difficult limitation that we have here is the lack of data on family background. Since 1996, we don't have any national accounts of this reproduction of intergeneral mobility. Just to conclude here, my final remarks, the main message that I would like to bring to you and to open to discussion is that until 2014, we saw a decrease in total income inequality, and the unfair component, the inequality of opportunity, has decreased as well. And we verified a convergence between the groups. The most disadvantaged workers or people in this sample were the most benefited by economic growth and the reduction of income inequality. But after 2015, we are seeing an increase in this total income inequality, and it's increasing in one of the countries that already are the most unequal in the world. So it's a very concerning picture. For some of you that would like to delve deeper in these studies, I would recommend here some further readings. The book of Romer in '98 is the most influential work. Then the book by the World Bank by Barros, Ferreira, and Vega and Saavedra on 2009, he brings a more empirical, a more practical way to estimate these trends. Our paper published in March that brings a detailed account of it. And there is a talk that Ferreira did for the World Bank last year when he puts inequality as cholesterol. Cholesterol, we all heard that there is the bad and the good cholesterol. He makes an analogy with inequality. There is a good component and a bad component for income inequality as well. Thank you for your attention.
Okay, Willian, thank you so much for the presentation, and congratulations on getting work very related to that already published. That's wonderful. I'm actually going to ask you more of a clarification aspect, which is this. I did not really understand on how in your methodology here you account for some national or regional programs to decrease those inequality. So I'm not a specialist of Brazil, but I'm aware of the national level Bolsa Familia program. So I don't really understand to what extent it may be accounted for here, because its purpose was to reduce those inequality. Or I can think about some states in Brazil that eventually put some kind of labor employment policies to minimize those inequality, eventually bringing more of the low income or a certain kind of folks more in a labor force. So how are those somewhat local or national policies accounted for in your work? I didn't get that.
We are not controlling for these trends, since Bolsa Familia is applied at a federal level. All states were benefit. It's a program that reaches about 40 million people, I think. So we are not controlling for it. Our main objective with this methodology is to use these circumstances and see how it evolves in the time.
Okay, I see your point. But still, I'm a little bit perplexed as to even a national level program like the Bolsa Familia eventually targeted more people in some part of Brazil than elsewhere, simply because the people who are targeted may happen to be more numerous in one part of Brazil than elsewhere. So to some extent, that may have an effect which is minimizing those regional inequalities that you are mapping at some point in your talk. So anyway, you know, I'm not specialist of this field, so maybe I'm totally wrong, I don't know. But I'm just curious whether there is some value added to to also consider any form of public intervention to minimize those inequality. Anyway, let's collect a few more comments and questions for Willian. So if you have any, unmute yourself.
Willian, this is Jeff Hewings. Congratulations. Very nice presentation. I have just two comments. First, the work of Thomas Piketty and Joe Stiglitz, focused mainly on Europe and North America, has revealed that a major source of increasing inequality is coming from non-wage and salary income. And I'm just wondering whether you have access to data. So when you talk about total income, are you really including non-wage and salary income or just wage and salary income? And the second comment is that you're looking at this in terms of the impact of receipt of income. And what we have found in some work in a number of different places is that when income is spent, for example, from the Bolsa Familia program, that the expenditure of that income is asymmetrically ending up in higher income people, so that you provide income to low income people, but when they spend that money, it ends up benefiting people with higher incomes more than lower incomes, so therefore enhancing or extending the inequality.
Okay. Piketty talks in his book, The Capital in the 21st Century, about this role of capital and in influencing these incomes, right? Here we are using only salaries, only income, but Piketty shows us that it has a major influence by family background. I think family background is capturing this effect of capital, because it's being reproduced over time through inheritances from father to son. And Piketty shows a concerning trend also, as the size of the families are diminishing over time. So it's concentrating more capital, and it would bring these estimates of family background and even more important role. And about the second question, the second commentary, I don't know if I quite understood it, but the targeting in Bolsa Familia, it had some problems, but it favors the northern part of Brazil. That is where the most part of the poor exists. So I think this expansion, the creation expansion in Bolsa Familia is behind this convergence, this effect of convergence between incomes over the time.
Okay, why don't we capture a few more comments or questions for Willian? All right, okay, go ahead.
I would like to ask you a question, contribution. My main limitation here is how to update this family background to 2020. What could be done, since we lack data on national level to address this problem?
Well, I think we're going to let the Brazilian scholars in the audience answer that. I'm not really familiar with data specific to Brazil. What do you guys think? I'm afraid, Willian, here we are.
I don't know either.
No ideas.
You're going to have to give us time to think about that. So anyway, yeah, I'm sorry, Willian, we don't know. But if anyone has an idea on that aspect, which actually is not specific to Brazil, we all are trying to get as most recent data as possible. So, but give us some time, Willian, and we may come back to you on this point. So in the meantime, thank you very much to the two presenters of today. It was really enjoyable. Thank you so much to Eduardo and Augusto for organizing this. And I see you all next week, same time and same place. Thank you so much, everybody. See you.
Thank you, Sandy. Thank you for the opportunity. Bye.
Bye-bye. Thank you.